Hi, my name is Rob Finnegan. I'm a kidney transplant patient, and earlier this year I wrote a blog on the proposed changes to the prescription of immunosuppression drugs. I thought I'd take the opportunity of just updating you on the experiences I'd had since that initial change was proposed. The changes from my own perspective would entail a 50-mile round trip just to pick up my immunosuppression drugs, as opposed to my existing system of ordering my drugs from a GP practice online. My pharmacist collecting that prescription 2 days later and sending me a text message when the drugs were ready for my collection. Having spoken to my GP, my renal centre and my pharmacist, none of whom were aware of these proposed changes, I decided to just sit back and wait to see how things developed. As it turned out, 2 months later, there was another development in the prescription of immunosuppression drugs, and that was driven by my local CCG, Clinical Commissioning Group, who had decided that for me to continue to receive repeat prescriptions of immunosuppression drugs from my GP, I would need to have a monthly blood test. I wasn't very happy with this proposal either. I already have more than enough blood tests. So I went to see my GP and pointed out to him that the GP practice already has access via renal patient review to all of my blood results from my renal centre. Why did I need to have yet more blood tests when they already had the information they needed? Thankfully, my GP agreed with me, made a note on my file, and I thought no more of the matter until my next repeat prescription, when I had a phone call from my local GP surgery saying that the doctor who was currently signing the prescriptions would not proceed without the card that was supposed to accompany my prescription detailing my blood tests. I reminded the surgery that they already had access to my blood results, but this simply wasn't good enough for them. They insisted on having the card. So I took the card down to the surgery, and eventually, 3 or 4 days later, I received notification that my drugs were ready for collection. I had some time to reflect after that and decided that, as it was very likely that the NHS England proposals would come into effect, I was probably better off biting the bullet and ordering my immunosuppression drug prescriptions from my renal centre. So at my next appointment with a consultant, I asked them for a supply of the immunosuppression drugs, and he wrote me a prescription immediately. I then had to spend an hour waiting in the outpatient pharmacy to have that prescription fulfilled, but nevertheless it worked, and it's worked largely fairly well since. Not 100%. Sometimes I've not been given enough to cover the time gap between renal clinic appointments, so I've had to make more than one journey just to collect my drugs, but it's working and I'm quite happy with that. I'd be even happier if in 2015 we could see the introduction of electronic prescription services, so that my renal centre could prescribe my drugs and I could continue to collect them from my local pharmacy, saving me a 50-mile round trip. It is quite bizarre that I'm now faced with the prospect of having part of my drug regime fulfilled from my local GP practice and part of it fulfilled by my renal centre, when in actual fact all of my drugs are prescribed by my renal centre, just that in the past my GP has fulfilled the delivery aspect of the prescription. I'm sure one day that's going to lead to even more confusion, the fact that my drug regime is split across two providers. So please, let's start thinking of the patient in all of this. Let's start seeing the introduction and use of the technology that already exists. My local branch of Boots, it's a tiny branch. They already have provision for electronic prescription services. Why hasn't one of the major renal centres in the country got that provision? I'd also like to just throw in a little request that when people talk about public patient involvement in their processes, it's actually meaningful and they actually listened to patients. I'm not sure where in NHS England's consultations or the CCG's consultations patients were actually involved in those processes. They can't possibly have envisaged a situation where someone has to travel, someone who on occasions is very ill, has to travel 50 miles simply to pick up their life-saving prescription. It is nonsense. Thanks for watching.